The anesthesia equipments and the machines. Now in this, first we'll start with the IV cannula, which is a lifeline for starting any surgery. Again, in pediatrics it is difficult, not because they don't have the veins and all. It is because the pediatrics, the children will create a nuisance for any injection. So anyways guys, what are the different sizes of IV cannula? You can look over here, size 22, 24, 20, 22, 20, and basically from 14 till 24 is there. 26 is also there, which is purple in color. Okay, which is commonly used for preterm infants or preterm newborns and all. You can use the 26, but for pediatric cases we are using 22 and 24 gauze IV cannula. Okay, and for adults commonly we are using 18 and 20 gauze IV cannula for any surgery. And if at all the patient is in shock, we are using 14 and 16 gauze IV cannula if the patient is in shock like condition. Okay, now guys, remember, now there are different size of IV cannula. The question they have been asking is color of the IV cannula, size of the IV cannula, flow rate of the IV cannula. So you need to remember a mnemonic, guys, for IV cannulas. O great God, please bless your people. When I am writing O great God, O stands for orange color, G stands for gray color, orange which is 14 gauze, gray which is 16 gauze, one more G stands for green color, 18 gauze. Please, pink stands for pink, which is 20 gauze. Next, bless is blue, 22 gauze. Next is yellow, 24 gauze. And next is purple, which is 26 gauze IV cannula. So this is the gauze sizes. Now what else we need to remember? The flow rate. So flow rate of the IV cannula. In the flow rate of the IV cannula, it is 26, 24. So we always have to remember from the bottom till top. And also flow rate, 26 gauze IV cannula. What is the flow? So it is 10 ml per minute, not per hour. 10 ml per minute of fluid is given. With 24 it is 20 ml per minute. With 22 gauze it is 30 ml per minute. With 20 gauze it is 50 ml per minute. With 18 gauze it is 100 ml per minute. With 16 gauze it is 200 ml per minute, and with 14 gauze it is 270 ml per minute of fluid can be given. So that's regarding what, guys? That's regarding the fluid that we give through the IV cannula. Now next, coming to the anesthesia machine. Anesthesia machine on anesthesia workstation. It is also called as Boyle's machine, as it was introduced by Edmund Gaskin Boyle in the year 1970. Not that important, but this Boyle's machine has different parts. It is divided into three systems: high pressure, intermediate pressure, and low pressure system. In high pressure system, what do you find? In high pressure system, there is cylinders, there is yoke valve assembly, there is pressure gauge system, there is pressure reducing valve. This is high pressure. Intermediate pressure system, you are having flow control valve, oxygen nitrous proportionating devices, and oxygen nitrous proportionating devices. Okay. Next, oxygen flush is there. When we press the oxygen flush, 35 to 75 liters of oxygen can be given. Central supply is there. Low pressure, you are having rotameter, vaporizer, and common gas outlet. Now coming to the parts of machine, the main part of the machine, which is called as cylinder. Now when we are talking about cylinder, guys, what we need to remember, cylinder is basically storing the gases in it, okay, which are essential for the patient. What gases? Oxygen is there, nitrous is there, okay, those gases. Now this cylinder is made up of what material? This cylinder is made up of two types of material. One is the most commonly used material, which is called as molybdenum, okay, which is basically a non-MRI compatible cylinder. Non-MRI compatible. You cannot take the cylinder into the MRI room. But if you want to take an oxygen cylinder into an MRI room, or if you want to take any cylinder into an MRI room, then you have to take the cylinders which are made up of titanium or aluminium. These are MRI compatible cylinders. What is the size of cylinders, guys? They are different sizes, size A and size J. Okay. Size A is the smallest size cylinder, J is the largest size cylinder, but most commonly used size cylinder is size E cylinder. That's regarding what, guys? That's regarding the cylinder. Now coming to the color of the cylinder. in the cylinder different gases are there, and different gases are given different color coding. By looking at the cylinder color you can tell this gas is there. Okay, now for oxygen, what is the color coding? For body and shoulder there is different color coding for the oxygen cylinder. So everyone, you have to remember what is the body color of oxygen cylinder. Oxygen is like, basically remember guys, if you keep a bodyguard with you, what will be the color dress of the bodyguard? He will be wearing a black suit with white shoulder cufflinks. Oxygen is like a bodyguard to us during the surgery. So it will be black body and white shoulders. Black body and white shoulders. Okay? Air. What is the cylinder color of air, guys? It is the opposite of oxygen, that is white body and black shoulders. Okay? In some countries we are using gray color cylinders for air. Okay? Next, nitrous. Nitrous, it is complete blue, blue body, blue shoulders. Entonox, you know what is Entonox, guys? Entonox is a mixture of nitrous and oxygen. 50% nitrous, 50% oxygen. Normally it is used for labor analgesia and all. We are giving while the patient is having contractions. During contraction we tell the patient to inhale this Entonox. Okay, so anyways, Entonox, what is the color coding, guys? It is blue body and white shoulders. Then there is carbon dioxide, which is completely gray in color cylinder. Carbon dioxide, which is used for pneumoperitoneum creation for laparoscopic cases, right? Now guys, remember this is the body and shoulder color. Sometimes they might also ask you what is this. Remember, in the like cylinders are storing the gases, but sometimes we are also, every hospital is equipped with a central supply of gases. In the central supply of gases there are some different pipelines given. Okay, there have been questions asking you about the pipe colors. The pipe color of oxygen, what is that? Always remember the pipe color of oxygen, air and nitrous is same to the color of the shoulder of the cylinder. Okay, oxygen, what is the shoulder color? White. So pipe color is what? The pipe color of oxygen, pipeline color is white. Okay, what is the air pipeline color? It is black. What is the nitrous pipeline color? It is blue. What is the pipeline color of vacuum? Vacuum is for suction. Remember guys, vacuum we write with V. V, if you add a stroke it looks like Y. So you need to remember vacuum pipeline color is yellow. Okay? And in central supply of gases, the pressure of air is 60 psi. 60 psi. Next, pin index system. Now guys, remember the cylinders are usually attached to the machine with the help of a steel assembly called as yoke valve assembly. In the yoke valve assembly, there is a system, an integrated system that prevents wrong attachment of the cylinder. That system is called as pin index system. Different gases are given different pin index system. Okay, so pins are basically on the machine and holes are on the cylinders. So pin index system is used to prevent the wrong attachment of cylinders. For air, what is the pin index system? First you need to understand this. Okay, small holes like this will be present. We'll just label this 1 2 3 4 5 6 7. Okay, if it is an air cylinder, it will occupy the first and the fifth port. So air pin index system is 1 5. If it is oxygen, it is 2 5. If it is nitrous, it is 3 5. If it is Entonox, it is 7. If it is carbon dioxide, it is 1 6 or 2 6. But how to remember this, guys? For remembering this, the thing is very simple. Air, nitrous and oxygen, air, oxygen and nitrous, so you can easily remember. Why? Because the second pin index system for both is same. What is that? 5. First we have to remember. So how will you remember? The first pin index system of air is 1. Remember, air is starting with the alphabet A, which is the first alphabet. Okay? So first alphabet of ABCD. So 1 5. That it can be easily remember. Oxygen, always write O2. So it will be, remember this 2 will come over here. 2 5. Second pin index always 5. Nitrous means what? 2 molecules of nitrogen and 1 molecule of oxygen. 3 molecules. So it will be 3 5. So this is the pin index system for this. Entonox. Entonox is a mixture of nitrogen and oxygen. So 7 alphabets are there in the word Entonox itself. So pin index system is 7. Carbon dioxide, we have to remember it's 1,6 or 2,6. Okay, so that is spin index system. Other is diameter index safety system. Diameter index safety system, just now I told you, central supply of gases will be coming with pipelines, and for this pipeline attachment, a safety system is integrated, which is called as diameter index safety system. यानी कि I cannot take oxygen pipe and try to push in the vacuum port. It won't go at all. Why? Because DISS system prevents that wrong attachment. DISS is nothing but diameter index safety system. Next, coming to what, guys? Vaporizer. Next part of the machine is vaporizer. Vaporizer is a device that stores liquid inhalational agent. It stores liquid inhalational agent in it. So what is the material the vaporizer is made up of? The vaporizer is made up of a material which is called as copper. Okay? But remember, all vaporizers, all gases are stored in on a same set of vaporizer except desflurane, that requires a special vaporizer. Why? Because desflurane is having a low boiling point and that special vaporizer is very costly. Okay? So desflurane requires a special vaporizer, and we also need to remember the color coding of vaporizer. How will you remember the color coding of vaporizer? Halothane, what is the color coding? Remember, guys, halothane, when you write, I used to remember halothane. Halothane means what? It is like a hellfire which is red in color. So halothane vaporizer will be red in color. Isoflurane, it is purple in color. Sevoflurane. Sevo is very simple, guys. Sevo, sevia, sweet. Sevia color, sevia mitha color is what? Yellow in color. So it is yellow vaporizer. D stands for desflurane. Des means desi. Desi color is what? Desi jersey color is blue. So it is blue color vaporizer. So you have to remember this colors of the vaporizer also. Vaporizer stores a liquid inhalational agent. Now, guys, coming to what? Coming to the breathing circuits. Anesthesia breathing circuits. Okay. So when we are talking about breathing circuits, they are semi-closed and closed circuits which are commonly used. In the semi-closed circuits, we are using commonly Mapleson circuit. Initially, there used to be open circuit where we used to use Chimblebush mask and all. That was long back. We are not using that. Semi-closed circuit are Mapleson circuit. Okay? These Mapleson circuit A, B, C, D, E, F are there. Starting with the first circuit, Mapleson A circuit. Remember, guys, Mapleson A circuit, the fresh gases will be flown from this part and then it will be gone to the patient. Remember, we are discussing about the Mapleson circuit. In the Mapleson circuit, Mapleson A circuit was introduced long back. At that time, there was no controlled ventilation and ventilator available. At that time, you were ventilating the patient spontaneously. Hence, Mapleson A is the circuit of choice for what ventilation, guys? Circuit of choice for spontaneous ventilation, Mapleson A circuit. Okay, but remember, with this circuit there was a problem. What was the problem, guys? There was a problem that the patient was rebreathing his own carbon dioxide. So in order to prevent this rebreathing, to this Mapleson A circuit, there was a guy whose name was Magel. He added an inner tube. This inner tube in Mapleson A circuit was responsible for, very, very important, the inner tube was responsible for expiratory gases and outer tube was responsible for inspiratory gases. Usually inner means inspiratory, you will see, na? But that was initially this circuit was introduced. So they don't know what to do, and also they have jumbled up and they did what? Inner tube which was responsible for expiratory and outer was responsible for inspiratory. And they did they gave a fresh gas flow which was equal to the minute volume. That was preventing the rebreathing, and this all changes were done by Magel. Hence, Mapleson A circuit is also called as Magel circuit. This is a circuit of choice for very, very important, guys, spontaneous ventilation. Okay, next is Mapleson B and C. Guys, we are not at all using Mapleson B and C circuit. Why? Because these are obsolete circuit. We are not using Mapleson D circuit. Mapleson D circuit is nowadays the most commonly used circuit, and this is the circuit of choice for what ventilation, guys? This is the circuit of choice for controlled ventilation. Very, very important for controlled ventilation. Okay? Now, but after introducing the circuit also, this is very important. Take after introducing the circuit, again it had the problem of rebreathing of carbon dioxide. So there was a guy whose name was Dr. Archie Bain. Okay, Dr. Archie Bain. He modified the circuit. What modification he has done? This circuit, what he done is he added an inner tube, but here it was simple. The inner tube was responsible for inspiratory gases and the outer was responsible for expiratory gases. Okay, and he told that if you want to prevent rebreathing more further, then fresh gas flow should be 1.6 times more than the minute volume. Okay, for this, after doing this modification, all things were prevented, all complications related to this prevented. Hence, this circuit is also called as what circuit? Bain's circuit. Very important circuit of choice for controlled ventilation. The length of the circuit, again an important thing. The length of the circuit is how much? 1.8 meters. For head and neck surgeries, we usually use this Bain's circuit. Next is what, guys? Mapleson E circuit. When we are talking about Mapleson E circuit, going back to the diagram of Mapleson E circuit, just look over here. From Mapleson D, if you remember, if you remove this bag and valve, it becomes what? Mapleson E circuit. So Mapleson E circuit is a bagless and valveless circuit. Bagless and valveless circuit. Okay, this is also called as Ayer's TPs. This was usually used for shifting the patient from one center to the other center, or from weaning the patient from the ventilator. We were using this circuit for shifting purpose or weaning the patient from ventilator. We use this circuit, but we are not using this circuit. This circuit was modified by a guy whose name was Jackson Rees. Jackson Rees modified this by adding what? By adding a bag. By adding a bag, they modified it and it became Jackson Rees modification. Hence, nowadays, this circuit is a Mapleson F circuit is a circuit of choice for control as well as spontaneous ventilation in home in pediatric cases. So guys, regarding the breathing circuit, remember, as we are starting with Mapleson A circuit, remember always that the APL valve, as we are starting with A till F, the APL valve is going away from the patient. Remember, initially it is near the patient, but as we are proceeding, the APL valve is away from the patient. So Mapleson A circuit, AVL valve is away. Bagless and valveless circuit is Mapleson E circuit. Okay. Next, guys, coming to closed circuit. Closed circuit meaning what? Closed circuit meaning now there is no APL valve. There is no expiratory valve. Remember, expiratory valve has the function to let out the expired carbon dioxide. Okay, but in closed circuit there is no expiratory valve. So as the patient is exhaling carbon dioxide, that exhaled carbon dioxide through the expiratory limb goes into this chamber, gets absorbed. So what is this chamber in this closed circuit called as? It is called as the soda lime, or basically carbon dioxide absorbing chamber. In that carbon dioxide absorbing chamber, the most commonly used material is soda lime. If not soda lime, there is bara lime and other agents also, but we are commonly using soda lime. So in closed circuit, the heart of closed circuit is what? It is a soda lime that absorbs carbon dioxide. What is the soda lime made up of? 80% calcium hydroxide, 16% water, 3% of sodium hydroxide, and 1 to 2% of potassium hydroxide plus silica, that is usually added to improve the hardness of the granules, improve hardness of granules. But guys, remember, when you are using the soda lime, some of the inhalational agents you have to avoid it. Why? Because if you use those inhalational agents with soda lime, then there are some chances that the patient will land up into some complications. What inhalational agents you have to avoid, guys? With soda lime, you have to avoid CT scan. CT scan should be avoided. C stands for chloroform. C stands for chloroform. T stands for trilene, and S stands for sevoflurane. Why? Because remember, this will react with soda lime to form some toxic compounds. Example, sevoflurane. Sevoflurane, when you give in low flows to the patient, what will it do? It reacts with the soda lime to form a compound called as compound A. Okay? Forms a compound called as compound A, which is also called as olefin, which is a nephrotoxic compound. Okay? Trilene reacts with soda lime to form phosgene and trichloroacetylene that can cause ARDS to the patient. Okay, so these are the agents. Chloroform we are not using, so you have to remember this. Next, barrelime. You know what is barrelime? Barrelime is made up of 80% of calcium hydroxide and 20% of barium hydroxide. Now, guys, remember, in barrelime, whenever you're using barrelime as a carbon dioxide absorbing chamber, three agents should be avoided. What three agents are we talking about? The agents dye. Now, what is dye agents, guys? D stands for desflurane. I stands for isoflurane. E stands for N-fluorine. What will happen if you use barrelime with these agents? Now, desflurane, isoflurane, N-fluorine, that they will react with barrelime to form a compound called as carbon monoxide. And maximum incidence of carbon monoxide is seen with, maximum incidence of carbon monoxide formation is seen with what, guys? It is seen with desflurane. Okay, it is seen with desflurane. Coming to the next device, guys, which is called as AMBU. What is meant by AMBU? AMBU full form is artificial manual breathing unit. Artificial manual breathing unit. Okay. Now on this AMBU bag, what we need to remember is, in the AMBU bag, and AMBU bag delivers 100% of oxygen to the patient. On the AMBU bag, you are having two valves. One is called as Rubens valve. Okay, a unidirectional valve which is called as Rubens valve that prevents the rebreathing and all, rebreathing of carbon dioxide. Apart from Rubens valve, there is one more valve which is called as pressure relieving valve. Usually in pediatric AMBUs, you will see this pressure relieving valve. Okay, so this is AMBU, artificial manual breathing unit. Okay, now guys, starting with airway devices. Airway devices. Now, in this airway device, what we need to remember is, we are talking about not a permanent airway device, we are talking about a temporary airway device that is called as laryngeal mask airway. Very, very important. Laryngeal mask airway. In this laryngeal mask airway, first generation is there, second generation is there, and third generation. Now, it's very simple, guys. First generation means what? Only a single port is there only for ventilation. Okay? You're having what? Classical LMA is there, flexometallic is there, Cobra LMA is there, and then AMBU Aura is there. AMBU Aura LMA. These are all what, guys? These are first generation LMA. All are having only one ventilating ports. Okay. If you add an extra port to this, it becomes a second generation LMA. Second generation means an extra port is added to it. Extra port is added to it. Okay, in that you are having LMA Proseal. Okay, Slippa is streamliner of the pharynx. LMA, this is LMA Proseal. Slippa is there, right? And iGel is the second generation LMA. LMA Supreme is there. AMBU Gain is there. Remember, guys, AMBU Aura is first generation. AMBU Gain is the second generation LMA. In the second generation LMA, you are having iGel, you're having LMS Supreme and AMBU Gain. All the second generation LMA, you are having two ports. One is the tracheal port and other is the esophageal port through which you put the Ryle's tube and you deflate the stomach. Basically, second generation are important. Why? Because they are preventing the risk of aspiration. Then there is third generation LMA. Third generation, there is Buska's mask. Okay? Intubating LMA is a special type of LMA. It is not under third generation. It is a special type of LMA through which, after putting in LMA, you can easily introduce the endotracheal tube through the other port and all. Okay. So third generation Buska's mask is excellent for positive pressure ventilation and superior gastric reflux, यानी कि suction clearance. For that also it is best. Now guys, remember LMA, is it a permanent airway? No. It's a temporary airway used for small type of surgeries, not big surgeries. and usually used in patients who are not at risk of any aspiration. Why? Because LMA itself can cause aspiration if the patient is full stomach. So LMA should be used for short procedures. It cannot be used for obese patients who are at risk of aspiration. It cannot be used when the patient is having oral cavity cancer or blood in the oral cavity. You cannot use. And how will you put the LMA? It is pretty simple, guys. So in this patient, I am holding the mask, and then now I will introduce the LMA. Just look over here. I'll hold the LMA in a pen-like fashion. Open the mouth. Okay? Open the mouth, clear the oral cavity, and now the LMA is inserted. Okay? That is a LMA insertion. It's pretty simple, guys. Anyone can put. You don't have to learn this technique of how to put an LMA and all. Okay? That's regarding what? That's regarding your laryngeal mask airways. So now coming to the next thing, in which we'll be discussing about the airway and the different steps to do airway management. The first thing about the airway is basically we need to know something about the anatomy of the airway, in which we'll be knowing which is the narrowest portion of adult airway. The narrowest portion of adult airway is the glottic opening. Glottic opening. And the narrowest portion of the child airway is subglottis. Subglottis. Okay. Now, what is the best way to secure the patient's airway? Guys, remember, the best way to secure any person's airway is not by LMA, it is always by endotracheal tube. So, endotracheal intubation is the best way to secure the airway. Now, in this endotracheal intubation, guys, remember, what are the types of endotracheal tubes? We are having red rubber tubes, we are having the PVC tubes, but commonly what we are using, we are not using red rubber tubes. These were the tubes which are used previously. Why we are not using? Just looking at the cuff you can tell why we are not using. Why? Because this red rubber tubes were high pressure, low volume, high pressure, low volume cuff. यानी कि whenever you were inflating air, it was creating a much pressure that was causing pressure necrosis of the trachea. That's why we are not using red rubber tubes. Instead of red rubber tubes, what we are using, guys, the most commonly tubes nowadays used is the PVC cuffed tubes. Uncuffed, we are not at all using, guys. Uncuffed tube was used for pediatrics, but nowadays we are not using. So this is the most common, guys. The PVC cuffed tubes are common. The reason why you are using PVC cuffed tubes, the reason for it is the PVC cuffed tubes are low pressure, high volume. Low pressure, high volume. Okay, this is regarding the endotracheal tubes. Okay, next. Now, in the endotracheal tube, guys, we also need to remember when we are discussing the part of endotracheal tube will be having one opening over here and one opening on the lateral side. Why is that opening and what is that opening? Basically, remember, guys, if at all we put the patient on ventilator for a longer period of time and due to secretions, if this opening, the main opening, the bevel end of the tube is getting blocked, the patient can be ventilated through the other opening, which is called as Murphy's eye, which is called as what? Murphy's eye. That provides an alternate route for ventilation. That provides an alternate route for ventilation. Now remember, guys, whenever I am telling that I'll be putting a 7.5 size tube or 8 size tube or 9 size tube, what does that size means? Guys, this have been a question many times. Okay? This came as a question many times. So whenever I am asking the size of the tube, the size is not the length of the tube, it is the internal diameter of the tube. It is the internal diameter of the endotracheal tube. Now you look at the internal diameter, guys, in this video. I am holding an endotracheal tube and this is the internal diameter of the endotracheal tube. Okay, and that internal diameter determines the resistance. That internal diameter determines the resistance. Okay, next. How will you go for endotracheal intubation? For endotracheal intubation, guys, we need to keep the patient in which position? Sniffing morning air posture. Imagine you are giving general anesthesia to the patient. So you take the patient in a sniffing morning air posture. What is sniffing morning air posture? You give flexion at the cervical spine and extension at the atlanto-occipital joint. Very, very important. After you make the patient lie down in this position, now the pharyngeal axis and the laryngeal axis and the oral all are in the same line, and you can easily see the vocal cords when you intubate. So this is the position used. So just look over here, guys. I take the patient in a sniffing morning air posture, then I put the laryngoscope into the patient's mouth, right? And once I put the laryngoscope into the patient's mouth, I lift the tongue. And once I lift the tongue, epiglottis will be there. Epiglottis will also be lifted. Once I see the epiglottis lifted, I will see the vocal cords. Under vision, now I am passing the endotracheal tube into the vocal cords. Okay, that's regarding what, guys? That's regarding the endotracheal intubation. But this position is given when a patient is a slim or when a patient is a moderately built. But if the patient is heavy, that's regarding what also be lifted, right? And once I put the guys, I take the patient in a sniffing morning air posture, then I put the laryngoscope into the patient's mouth, right? And once I put the laryngoscope into the patient's mouth, I lift the tongue. And once I lift the tongue, epiglottis will be there. Epiglottis will also be lifted. Once I see the epiglottis lifted, I will see the vocal cords. Under vision, now I am passing the endotracheal tube into the vocal cords. Okay, that's regarding what, guys? That's regarding the endotracheal intubation. But this position is given when a patient is a slim or when a patient is a moderately built. But if the patient is heavily built, or if the patient is obese, you cannot take that position, guys. You have to take which position? You have to take a rammed up position. What is rammed up position? You keep many pillows or many stuff beneath the patient's shoulder so that his head is a bit elevated, so that his oral and pharyngeal axis comes in a single direction, and you can see the vocal cords once you put the laryngoscope. So this rammed up position is used in which position, which patients? Obese patients, we use a rammed up position. So once you take the patient in a I told you, once you take the patient in a sniffing morning air posture, you take the laryngoscope. Now what are the types of laryngoscope, guys? Remember, we are having many laryngoscope, but commonly what we are using is a curved blade laryngoscope, which is called as Macintosh laryngoscope, which is commonly used in adults, and a straight blade laryngoscope, which is called as Miller's laryngoscope, which is commonly used in pediatrics. Why? Because pediatrics, these patients will be having a large epiglottis, which can be easily lifted through a Miller's laryngoscope. Now to this laryngoscope, now they have been very much ease given to this laryngoscope, so that you don't feel the difficulty of intubation. So what are the modifications that done to this laryngoscope? There is one modified laryngoscope which is called as McCoy's laryngoscope. You can see over here, McCoy is nothing but, to this laryngoscope handle they have added a small structure over here, which is basically helping you to lift the epiglottis as well as the tongue. That is McCoy laryngoscope. Now this is what, guys? This is McGrath's laryngoscope. And now also we are having video laryngoscope. Just look over here in this slide, you will find glidoscope is there, CMAC is there, CMAC blade D type is there, McGrath laryngoscope is there, A-track is there. These are all type of video laryngoscope, so that once you are putting the laryngoscope, you don't have to lift the tongue and you don't have to just squeeze yourself to watch the vocal cords. You can just put the laryngoscope on the screen, you will see what vocal cords. Okay, mostly this can be very easily or very handy in cases of difficult airway. Okay, now guys, apart from this laryngoscope, we are also having some things which are helping us for intubation. If it is a difficult airway, right? If the patient is having Cormack-Lehan grade 3. Now guys, what is Cormack-Lehan grade 3? Before going or before proceeding further, first I'll tell you about Cormack-Lehan, then I'll tell you what are those structures which are used for intubation. Now guys, remember, Cormack-Lehan grading is not given when the patient is coming for you for a PAC. Cormack-Lehan grading is done while you are intubating. That's why it is not a predictor of difficult airway, guys. Okay, at the time of intubation, you will come to know what Cormack-Lehan grading is the patient is having. So you put the laryngoscope, you lift the tongue, and based upon the appearance of the vocal cords, Cormack-Lehane grading is given. Grade 1 is what, guys? Remember, if the whole laryngeal aperture is visible. Whole laryngeal aperture is visible. Okay, or full glottic opening you will see, that is Cormack grade 1. Grade 2 means what, guys? Grade 2 means only posterior wall visible, only posterior wall visible. Grade 3 means what, guys? Only while putting the laryngoscope you will see only epiglottis visible, only epiglottis visible. ठीक है, vocal cords are not at all visible. ठीक है. Grade 4 means what? Grade 4 means epiglottis is also not visible. Epiglottis also not visible. ठीक है. Again, in those cases, right, you have to go, remember, if epiglottis is also not visible, you have to keep anatomy in your mind and you have to go for a blind intubation, or you can go for a fiber optic intubation if fiber optic is available with you. But guys, remember, imagine you are doing intubation and you see a Cormack-Lehane grade 3. Grade 3 means only epiglottis is visible. What you will do? Will you put the endotracheal tube? If you put the endotracheal tube blindly, two things can happen. Either it can go into the trachea or it can go into the esophagus, but we cannot afford to take the risk. So what we need to do is we take the help of this structure which is called as bougie. This is called as bougie. Okay? What we'll do is basically we'll follow the anatomy. If at all you are seeing just the epiglottis, the bougie, this end of the bougie will be curved like this. Okay? So what you will do is blindly you insert the bougie, following the epiglottis you will enter the trachea. You will feel the tracheal rings while you enter it, and then you just slide over the tube. This is bougie and this is stylet, guys. This thing is called as stylet. Okay, stylet is basically used for when you're using flexometallic tubes, and all will come to it what flexometallic tubes are. Okay, so that's regarding Cormack-Lehane grading and endotracheal tube. Now guys, remember, once you intubate the patient, at what position are you fixing the endotracheal tube? Now I'm not asking you the length at what you're fixing. Basically I'm asking, in the, this is the trachea and these are the lungs. Okay, these are the lungs. Now, where will you fix the endotracheal tube inside the trachea? When you're fixing the endotracheal tube, it should be always 3 to 4 centimeters above the carina. 3 to 4